Phlebotomy Certification 101. Question 1. Icteric specimens are caused by Option F. High lipids, Option B. High bilirubin, Option C. Low glucose, Option D. High potassium. The correct answer is Option B. High bilirubin. Icterus refers to the yellow-orange discoloration of serum or plasma caused by elevated bilirubin levels, seen in conditions such as liver disease and hemolytic anemia. This is distinct from lipemia, milky appearance, and hemolysis, pink-red discoloration. Question 2. Why is it important to record collection time? Option A. Legal documentation and accurate test interpretation. Option B. For billing only. Option C. To track phlebotomist performance. Option D. Not important. The correct answer is Option A. Legal documentation and accurate test interpretation. Collection time is critical for timed tests, for example, therapeutic drug monitoring, glucose tolerance, tracking specimen viability, legal chain of custody, and accurate clinical interpretation. It is a mandatory documentation element under most accreditation standards. Question 3. Hemolysis in a blood sample is most often caused by Option A. Proper tube mixing. Option B. Using a large gauge needle. Option C. Excessive force during collection. Option D. Inverting tubes 8 to 10 times. The correct answer is Option C. Excessive force during collection. Excessive force when aspirating blood through a syringe or expelling it into a tube causes turbulent flow that ruptures red blood cell membranes, resulting in hemolysis. Using a large bore needle actually reduces hemolysis risk by minimizing shear stress on cells. Question 4. Which lab test is sensitive to delayed processing? Option A. Potassium. Option B. Sodium. Option C. Blood culture. Option D. Glucose. The correct answer is Option A. Potassium. Potassium is highly sensitive to delayed processing because RBC metabolism and cell lysis after collection release intracellular potassium into the plasma, falsely elevating results. Specimens for potassium must be centrifuged and separated promptly. Question 5. What is the purpose of a serum separator tube? Option A. Prevent clotting. Option B. Separate serum from cells. Option C. Provide anticoagulant. Option D. Preserve whole blood. The correct answer is Option B. Separate serum from cells. Serum separator tubes contain a gel that, upon centrifugation, forms a stable barrier between the serum and the cellular clot, facilitating easy serum harvest for chemistry testing. The clot activator promotes rapid clot formation. SSD tubes do not contain anticoagulants. Question 6. The winged infusion set is also known as a Option A. Butterfly needle. Option B. Lancet. Option C. Syringe. Option D. Vikutina. The correct answer is Option A. Butterfly needle. The winged infusion set, commonly called a butterfly needle, features flexible plastic wings and a short bevel needle ideal for small, fragile, or difficult veins. The lancet is used for capillary puncture, while a vikutina is the evacuated tube holder system. Question 7. A phlebotomist notices petechiae on a patient's arm. This may indicate Option A. Normal finding. Option B. Fragile capillaries or platelet disorder. Option C. Allergic reaction to tourniquet. Option D. Dehydration. The correct answer is Option B. Fragile capillaries or platelet disorder. Petechiae, small pinpoint hemorrhages under the skin, indicate capillary fragility, thrombocytopenia, or platelet dysfunction. They can also appear when a tourniquet is applied too tightly or for too long. The finding must be documented and the phlebotomist should proceed with caution. Question 8. If a tube is underfilled, test results may be Option A. Accurate. Option B. Altered due to additive ratio imbalance. Option C. Unaffected. Option D. Faster to process. The correct answer is Option B. Altered due to additive ratio imbalance. Underfilling alters the ratio of blood to additive, particularly critical in citrate tubes where excess citrate causes falsely prolonged patient/PTT. Proper fill volumes are calibrated by the manufacturer and must be achieved for valid results. Question 9. Which of the following stops blood clotting by inhibiting thrombin? Option A, boxylate. Option B, DDTA. Option C, heparin. Option D, citrate. The correct answer is option C, heparin. Heparin inhibits coagulation by potentiating antithrombin 3, which inactivates thrombin and factors A. This distinguishes it from EDTA and citrate, which both work by chelating calcium, and from oxalate, which also chelates calcium but is rarely used in modern practice. Question 10. A tourniquet should be tied? Option A, tightly enough to stop arterial flow. Option B, loosely over pants. Option C, 2 inches above draw site. Option D, at least 12 inches above site. The correct answer is option C, 2 inches above draw site. The tourniquet should be placed approximately 3 to 4 inches, about 2 inches by common practice, above the intended venipuncture site to provide sufficient venous engorgement while preserving arterial flow. Tying it too high or too loosely fails to adequately distend the vein. Question 11. For a 2-year-old child, the best collection site is: Option A, heel or finger. Option B, ankle vein. Option C, femoral artery. Option D, basilic vein. The correct answer is option A, heel or finger. Capillary puncture from the heel or finger, lateral fingertip, is preferred for young children when small volumes suffice, as it is less traumatic and safer than venipuncture. Femoral and basilic sites carry higher complication risks and are not routine pediatric choices. Question 12. Which action may cause hemolysis? Option A, gentle inversion. Option B, vigorous shaking. Option C, correct needle gauge. Option D, proper tourniquet placement. The correct answer is option B, vigorous shaking. Vigorous shaking creates mechanical shear forces that rupture RBC membranes, releasing hemoglobin and intracellular contents into the plasma. Gentle inversion, not shaking, is the correct mixing method. Tubes should never be vortexed or shaken. Question 13. Why is it important to invert anticoagulant tubes gently? Option A, mix additive without hemolysis. Option B, warm sample. Option C, sediment cells. Option D, activate clotting. The correct answer is option A, mix additive without hemolysis. Gentle inversion, 8 to 10 times, ensures complete mixing of the anticoagulant with blood to prevent clotting while avoiding the mechanical trauma of vigorous shaking, which lyses red blood cells and causes hemolysis that invalidates many laboratory tests. Question 14. Which is true about using evacuated tubes? Option A, remove cap before insertion. Option B, push tube into holder. Option C, tube fills automatically by vacuum. Option D, requires syringe. The correct answer is option C, tube fills automatically by vacuum. Evacuated tubes fill automatically when inserted into the holder and the needle enters the vein. The preset vacuum draws blood into the tube without manual aspiration. Caps must not be removed before insertion as this destroys the vacuum and prevents filling. Question 15. If a patient has an 4 in both arms, the phlebotomist should: Option A, draw below 1/4. Option B, draw from 4 site anyway. Option C, seek assistance for alternate site. Option D, draw from foot. The correct answer is option C, seek assistance for alternate site. When both arms have active force, the phlebotomist should consult the nurse or physician to identify an appropriate alternate collection site such as the hand or wrist. Drawing from or below an 4 site can result in diluted or contaminated specimens. Question 16. Which tube is most suitable for stat chemistry tests? Option A, gray. Option B, green heparin. Option C, light blue. Option D, lavender. The correct answer is option B, green heparin. Green top heparin tubes are preferred for stat chemistry because plasma can be separated immediately after centrifugation without requiring a clotting period. SST/red top tubes require 30 minutes for clot formation before processing, which delays stat results. Question 17. Which is a complication of repeated venipuncture? Option A, hemophilia. Option B, vein sclerosis. Option C, anemia only. Option D, hypertension. The correct answer is option B, vein sclerosis. Repeated venipuncture in the same vein can lead to sclerosis, fibrosis and hardening of the vein wall, making future access difficult. Phlebotomists should rotate puncture sites to preserve vein integrity in patients requiring frequent blood draws. Question 18. A lipemic specimen may cause which of the following? Option A, fatty plasma. Option B, hemolysis. Option C, icterus. Option D, clotting. The correct answer is option A, fatty plasma. Lipemia produces a milky, turbid plasma appearance due to elevated triglycerides and chylomicrons, often described as fatty plasma. This is distinct from icterus, elevated bilirubin causing yellow discoloration, and hemolysis, red discoloration from ruptured RBCs. Question 19. Which is the best action if patient complains of pain? Option A, continue immediately. Option B, pause and check technique. Option C, apply more pressure. Option D, ignore complaint. The correct answer is option B, pause and check technique. Patient complaints of pain during venipuncture should prompt the phlebotomist to pause and assess for needle misplacement, nerve proximity, or vein damage. Continuing without evaluation risks nerve injury. Ignoring complaints violates patient rights and professional standards. Question 20. How should a heel stick be performed on an infant? Option A, medial or lateral plantar surface. Option B, center of heel. Option C, arch of foot. Option D, toes only. The correct answer is option A, medial or lateral plantar surface. CLSI guidelines specify that infant heel sticks should be performed on the medial or lateral plantar surface of the heel to avoid the posterior curvature and calcaneus bone. Puncturing the center or arch risks bone injury, osteomyelitis, and nerve damage.